Reflecting on our 40 years, the milestones I would say I am proud of have been through remarkable strides in advancing sexual and reproductive health across the country. Among these that I'm proud of, the first is expanding access to quality family planning and reproductive health services to millions of women, especially in underserved and remote areas. We have served over 10 million clients over the past 40 years, contributing to achieving our national and international sustainable development goals.
Outreach entails we move by our own vehicle, we move to hard to reach areas. For example, Nairobi Family Planning Clinic, we cover Nairobi, Kajiado, Narok, Baringo, and Nakuru. What we basically do, we have a team of mobilizers, we call them demand generation activities that are conducted before you conduct an outreach. We have a regional coordination that happens in Nairobi. So before we set up a date, we have a meeting, a sit down with the county people. Then they tell us where there is need for us to go there as an outreach. For example, a very hard to reach area like now Chandaria where we are currently, it was selected by the county reproductive health coordinator of this region. Basically, they have a bigger capacity, but they have less manpower to cover those clients that are there.
Maristops was known for outreach services, which was going to public facilities and giving services, that is sexual reproductive health services. But because of the intense of the resources that were needed for outreach services, we came up with a more sustainable way to do services, which was now the PSS channel. That's how it came about. Through our interventions, we have been able to train even mid-level clinical officers. They are able to do bilateral tubal ligation as an outpatient service. The clients come in the morning, they are served and go back home.
There's a remarkable improvement in terms of client flow within the facilities that we are supporting as compared to the days that we were not having this program on board.
We have also seen a good number of clients coming in for the services, and our clients are expressing satisfaction in the services that they are receiving because the staff have been capacity built to a level where the services that they offer is at another level.
As we talk, Bungoma County is one of the counties that is having good number of services for men, for family planning, especially permanent methods. We are mentioning one of them is vasectomy. You find that nowadays men can work in facilities and be able to be given a service, a vasectomy, whereby in other areas it's still a stigma. When you stand and start telling men to come and practice family planning, they look at you, hey, what is it? So, but for Bungoma, because of the work and efforts that Maristops has put in, men can work in our facilities.
One of the biggest challenge we have in Kenya is the high teenage pregnancy rates. And with high teenage pregnancy rates comes other issues that follow through. And so to respond to some of these things, MSI Kenya put in a proposal to start the Start Small project that was primarily going to tackle these things. So currently we have slightly over 80 groups of these girls, young girls, and we have so far supported almost 1,400 girls on economic empowerment. Our target is to have had 2,500 girls before the end of project, which is in December, because we also want to see the value addition to the child, to the girl, and to her family, because that was that's the main agenda.
Tulifundishwa kuhusu kuna types of family planning, kuna jadel, kuna hii ya sindano, dipple, na kuna coil, na tulifunza effects pia tulifunzwa. hii ukifanya italeta madhara, hii ukifanya itakuleta kwa hii.
They said that you start small, what you have, and you get, and you go where you want. Then we start from saving, from community, from village, among ourselves, among youths. Then we come, when they gave us money, then we suggest that we'll take poultry project. And it succeeded well. I motivated myself through this project.
MSI Reproductive Choices has a number of 16 clinics, one of which is a maternity. That's our Eastleigh Nursing Home. We have 4 premier clinics located in Nairobi, here in Nairobi, and then the rest of the 10 clinics are strategically located in various parts of the country. So we have one in Mombasa, we have Nyeri, Meru, Uasin Gishu, Kisumu, yeah, you name it. So we ensure that all our clients are able to access our services despite their location.
So about the AMUA network, which we call the social franchise here in Kenya, it started in Kenya in 2004. So we've been in the game for about 21 years now. We are in both rural and urban setups. So in the urban setups, most of our clinics are in the informal settlements, what we call the slums, where we've been able to reach the underserved mothers with quality services and also very affordable services compared to some of our channels of service delivery like our centers.
We estimate that 10% of the total demand of clients who were served by family planning were served by services offered by MSI Reproductive Choices Kenya. In 2024 alone, we were able to serve over 760,000 people who came through our Maristops clinic or our Maristops supported services. Additionally, over the last 1 year, we estimate that we have 1,500 Kenyans who are using a method offered by Maristops Kenya. We couldn't have known all this if we didn't have a robust data system that supports us to understand who we are serving, the experience of the clients in our service delivery points, and also help us to know the areas in which we can improve.
In social marketing, we see the distributors and the pharmacists as our key partners. Yeah, we rely on them fully to be able to push our products in the field, whether it's from the distributor who's pushing it to the pharmacy or the pharmacy who's pushing it to the end user. So how we work with them to ensure that our product is available and it's affordable, we ensure that we have placed our products at all the key distributors in the country, so that when a pharmacist is able to order, the product will be available at that point. Then we have our teams on ground who go around getting transfer orders to the distributors and also creating awareness to the pharmacies that our product is at such and such distributor. You'll be able to find it. So other ways that we ensure that the distributors have our products is we give them discounts so that they are able to consume more and more of our products and volume of our products.
We have a contact center that operates every day. Basically what we do is we respond to clients. We give them accurate information when it comes to sexual and reproductive health services. And we also refer the clients, if need be, to the nearest facility for a medical checkup.
As we celebrate MSI at 40, this is a moment for us to be proud of the quality that we've offered to our clients and the underserved communities that we've been able to reach with high quality client-centered care.
It's really exciting to be here celebrating MSI Reproductive Choices 40th year anniversary. It's a time of celebration. It's a time of reflection. It's a time when we look back over 4 decades of work across this country in assisting our young women in their reproductive choices. Millions of lives have been transformed. We're really excited because our staff and our partners dedicated, we work very closely together, and we are able to help Kenyans achieve their reproductive choices using their rights, their inborn rights. This is also a time of readiness for the next chapter for MSI Reproductive Choices Kenya.
I think this is a fantastic moment in any organisation, particularly in this sector, to be 40 years old and still thriving and doing great work. I think is testament to all of the hard work that you do on a daily basis. So it's a real privilege to be here this week and to be able to celebrate with you. So well done to all of you, and keep up the brilliant work, and we look forward to seeing the next 40 years.